Hello and welcome everyone to today's webinar titled Tech-Enabled Solutions for Addressing Health-Related Social Needs, Experiences from Iowa and Kentucky Medicaid. My name is Twin Tran, a Senior Program Officer with CHCS, and I will be your moderator for today's session. This webinar is made possible with support from Melina Cares Foundation, Common Spirit Health, Hope Lab, Schmidt Futures, and the Helmsley Charitable Trust. Next slide, please. So here's what we'll cover during today's webinar. We'll first provide some contextual information to ground today's panel, including an overview of the Medicaid Innovation Collaborative. We'll also talk about opportunities to leverage tech-enabled solutions to improve care for Medicaid enrollees. We'll then fly you over to Iowa and Kentucky to hear more about their specific on-the-ground experiences in piloting tech-enabled innovations. We'll also have an opportunity for an audience Q&A, and then we'll share details with how you can get involved before wrapping up our webinar. So next slide, please. I am so excited to welcome my colleague, Vinu Aulick, Executive Director of the Medicaid Innovation Collaborative, to provide an overview and introduction for the Medicaid Innovation Collaborative and set the context for our panel to come. So please, next slide. But before we get started, just a quick note on who we are at the Center for Healthcare Strategies. CHCS is a policy design and implementation partner dedicated to strengthening the U.S. healthcare system to support high quality and equitable care, particularly for people served by Medicaid. To achieve our mission, we partner with state and federal agencies, health plans, heart providers, community-based organizations, and community members to address obstacles that stand in the way of good health and well-being. This includes barriers like poverty, complex health and social needs, and systemic racism. Of particular relevance to today's webinar, CHCS is a technical assistance partner to the Medicaid Innovation Collaborative. I like to take this time to also thank my other CHCS colleagues along the project with me. They include Nita Joseph, Allison Hamlin, and Kelsey Brickman. And thanks to our communications team for supporting our webinar today. Without further ado, Vinu, I will pass it over to you.
So as Twin mentioned, my name is Vinu Aulick, and very excited to be here today and share the story and experiences from the Medicaid Innovation Collaborative. As someone who's worked at the intersection of health equity, Medicaid, and innovation for most of my career, I firmly believe that if we are to address some of the most complex equity challenges, it requires a variety of solutions to really meet the needs of people served by Medicaid. So next slide. And I also think that as part of these solutions, digital health or tech-enabled private sector solutions have a critical role to play to address equity. We know that the current solutions alone are not enough, and think that the innovation, entrepreneurship of many of these companies that you see on this slide are really building solutions to address some really critical equity issues around social determinants of health, maternity care, behavioral health, and other areas. But on the next slide, but we also know that in order to get these solutions adopted in Medicaid, it's quite complex. Medicaid is fragmented, which makes it hard to scale these innovations. Unlike on the commercial side or for Medicare populations, entrepreneurs and some of these solutions have to go state by state, plan by plan to navigate the unique needs and the complex policies that we have within each state. And now on top of that, there's not only, I think we probably have to update the slide, not only hundreds of emerging innovations, but probably in the thousands to sort through. And that is why, on the next slide, why we started the Medicaid Innovation Collaborative. We really aim to improve the health and well-being of individuals enrolled in Medicaid by advancing the adoption of tech-enabled solutions and tech-enabled innovations. And we do that by working with individual states. So today you're really going to hear about the work we've been doing in two of the states. On the next slide. The MIC is also a program of Acumen America, and we're a nonprofit social impact investment firm focused on serving and supporting low-income communities and alleviating poverty. As part of that, health is an important area of focus for Acumen, and we realized that investment alone isn't enough to make change. So we built the MIC to create a systems change approach that you're going to hear more about today. As Twin mentioned, we've been partnering with the Center for Healthcare Strategy since the inception of the program, and they've been a critical partner in providing technical assistance and support to Medicaid teams, encouraging peer sharing and learning, and helping disseminate findings like our webinar today. And as Twin mentioned, we couldn't do this work without our funders. This program is, we felt like it needed to be no costs involved to our state partners and our plans. And so we rely on our funding partners. And this past year, working with the Helmsley Charitable Trust and Schmidt Futures and Molina Cares, and previous years from support from Common Spirit and Hope Lab. So without them, it would be difficult to do this work. So on the next slide, so I'd love to tell you about our program and the approach we take. So as I mentioned, we take a state level approach because, as you know, Medicaid operates from state to state differences. The past year, we did this work in New York, Kentucky, and Iowa, and we really focused on the common goal of addressing health-related social needs. Our approach starts by really understanding the problem and rooting it in the needs of Medicaid beneficiaries. We also ensure alignment with state priorities, making sure that we ensure that the state's priorities are aligned with the managed care plans in the state and also tied to the community goals, and understand the unique context of inequities in the state. And Emily, if you could flip to the next slide, I'm going to come back to this, but I wanted to be able to explain how we really do take that Medicaid beneficiary viewpoint in. So this past year, we did deep Medicaid beneficiary research with a research partner, Goodwin Simon Research, and they did both focus groups, interviews, quantitative research, really trying to understand how the needs around health-related social needs varied between the three states. And we also have been using an advisory board of Medicaid beneficiaries to guide this entire process, from looking at the research, understanding their needs, looking at the solutions out there, looking at the pilots. They've been critical, and we've been doing this work in partnership with them from the beginning. We also partnered with Siren out of UCSF to help us understand the evidence of what works around social needs. And through all of that research, I think we went into this thinking, well, maybe there was one social need that might stand out more than another. And what we heard from our Medicaid members was that it required these were all very interrelated. And so we were looking for the best solutions around food and nutrition, housing, transportation, economic stability, navigation, and infrastructure. And if you flip back to the previous slide, once we realized what the focus area was, we went out and sourced and identified over 100 solutions out there and from that used a robust panel of state Medicaid leaders, managed care plans, consumers, and subject matter experts to review the solutions. After that, we got down to 13 solutions and had those companies present at a virtual showcase where people from all those stakeholder groups were able to ask questions and helped sort of vet. So starting with the big over 100 down to the solutions that made sense, uncover the best solutions. And then we really work to catalyze that into action. And if you flip to 2 slides up, yes, thank you. So once we were able to get to the solutions of most interest, we did a lot of work to facilitate conversations, both between the states and the health plans, between the plans alone, between the plans and the social solution providers, trying to see where the partnerships made sense, where it aligned with the needs. And then through funding from our partners at the Helmsley Charitable Trust, we were able to offer modest incentives to help conduct pilots and encourage partnerships. And what we learned in speaking to our managed care plan partners was that they were really looking for opportunities to de-risk some of the pilots and to start thinking about learning what it really takes to work together and test out and see what solutions actually had impact for Medicaid members in the state. We also partnered with the CCHE, the Center for Community Health and Evaluation, as an external evaluation partner to really facilitate a process where we agreed on what was our logic model, what were the metrics, and ensure that from the beginning, we weren't thinking of it pilot for a pilot's sake, but really as a path to sustainability. And if we could agree upon those measures from the beginning, we would be in a much better position to be able to have either follow-on contracts and thinking about how we may be able to address any shifts in policy to enable these solutions to survive. So from that application process, we put out a call from the solutions to see if there was interest in any partnerships and received 10 applications. And if you look at the next slide, what it resulted in was we were able to fund and support 5 really interesting partnerships between health plans and solution providers. Today, you're going to be hearing from a partnership in Kentucky with Farm Box, and you'll also be hearing about the Kaizen implementation in Iowa. But I wanted to make sure you also knew about the 3 other pilots that are happening, because we're really also quite excited to be able to learn about those solutions. The other ones in Kentucky, there's an exciting partnership to address the needs of unhoused populations by providing financial and social supports with a path to housing through partnership between Samaritan and Aetna and Humana. And then we also have a food as medicine with nutrition coaching. Apologize, the logo didn't get switched out, but Free from Market, which is now Attain Health, is partnering with Anthem, Blue Cross Blue Shield in Kentucky. And then we are also really excited about working on a partnership in New York, which is building on the heels of the recently passed 1115 waiver, supporting a partnership between 2 of the tech companies, Samaritan and Ready Computing, a social care network or an emerging social care network, and a managed care plan to demonstrate how these solutions can address needs of unhoused populations in Staten Island. So we're really excited to share more about the pilots and where we are in those experiences today, and look forward to also coming back in hopefully another 5 or 6 months to show some of the impacts of those solutions. So the next slide, before I hand it over to Twin for the panel, I also wanted to just close by saying that we believe that MIC collaboration is an important process to help resolve some critical hurdles when we're adopting and sustaining solutions for Medicaid beneficiary. The process is very much directed by the state and helps align priorities and coordinates with the managed care plans. It offers opportunities for some cross MCO collaboration that you'll hear about today. Also, as a neutral convener, MIC can act as sort of a Sherpa for this complex collaboration and coordination. We're also able to help identify the right solutions and sort of filter out the noise to get to the solutions that really work for Medicaid beneficiaries with scale and impact. And most importantly, we root all of this work in the voice of the Medicaid beneficiary. So with that, I wanted to pass it back over to Twin. So now that you had that context, and she will help guide the panel discussion.
All right, thank you so much, Vinu. And just a great use of the term Sherpa. So next slide, please. I am so delighted to introduce our panelists for today's discussion. We have Danita Coulter, Branch Manager, Equity and Determinants of Health from Kentucky Department of Medicaid Services. We have Rebecca Curtis, Deputy Director of Operations, Iowa Medicaid. We have Mindy Kniebel, CEO, Kaizen Health. Kristen Pendergraft, Senior Director of Quality Improvement from Iowa Total Care. Stephanie Stone, Assistant Vice President for Healthcare Services, Passport by Molina Healthcare, and Ashley Trainer, CEO and founder of Farmbox RX. Panelists, thank you so much for being here. At this time, I'd like to invite you to turn on your video and we'll get started. Okay. Okay. Again, just so wonderful having you here for a rich discussion we're going to have. First, I'd like to begin our discussion by hearing from our state Medicaid partners. Danita, I will pose this question for you. What have been your goals for participating in MIC, and what has been most valuable to you through MIC?
Thank you, Twin. So I think the goals for Kentucky, as we have participated throughout the MIC, some of the most important things for us has been to identify and develop solutions specifically to address health disparities for the members enrolled within Kentucky Medicaid, and also to the provision of services to those members. We hope to identify and develop solutions through the partnerships with our MCOs and to create quality improvement as we identify those solutions. We want to learn strategies that are focusing on decreasing those health disparities, such as those specifically related to service provision, payment structure, and data collection. We also wanted to focus on ways that we could incorporate a more robust community health worker program into our access to care model. When we are thinking about the insight that we have gained and our most valuable insight around the perspectives from our members as it relates to our members, we think about that research phase. Some of the key findings from that research was that direct feedback from some of our Kentucky participants in that research, there was some direct quotes where those members referenced dealing with stigma and solutions that we could find. And so through the tech-enabled solutions that we learned from participating with the MIC, they referenced that finding more comfortable solutions to help remove the stigma, such as text, email, and online platforms, would be ways to address those. So Kentucky used those key findings as a way to look at that insight and leverage things like building upon our current partnerships that we have, while also expanding upon those partnerships that we created through our participation in the MIC. We also looked at this as a great opportunity to look at our current technical capabilities that we have and find how we could coordinate across our partners and look at ways that we could use those tech-enabled solutions to create a successful strategy to create those more comfortable communication solutions to address those disparities.
Well, thank you for sharing those insights and how members are informing your activities within the Medicaid Innovation Collaborative. Rebecca, I'll pose to you the same question. What have been your goals and what has been most valuable to you through the MIC?
I don't know how to follow Danita. She's so articulate, and I just kind of put it out there. We had some really simple goals. We just wanted to make sure that we could do everything that we possibly could to ease awareness for our members about access to services that address social drivers of health, what those look like, how they can look like with tech-enabled solutions. We wanted to increase the equity of access to care across Medicaid members. It was apparent, so apparent, that folks struggle with access to these services. And so quickly, we realized that we needed to find and provide better and greater access to transportation for Medicaid members. We specifically wanted to look at reducing service insecurity for Iowa Medicaid members, making sure that we were truly understanding what the quantifiable and anecdotal reported transportation barriers were, because we have a lot of town halls where we invite members to come and visit with us. And I mean, we were just getting pounded every week. We can't get transportation. We can't, but we couldn't put our finger on the pulse of it and kind of figure out where our gaps were and why we weren't meeting that final 5% of folks and what they needed in order to be able to identify the operational issues that we were having with transportation specifically. So pulling together with Mick and having all of you provide to us the research, the selection showcase, the action planning, all of the work that y'all did with the surveys and talking to members and then providing the data back to us was incredibly important to what we needed to do to take it from there to implement or to attempt to implement solutions that can address all of these disparities and improve the outcomes associated with these folks and their social determinants of health, and how we can make sure that we're utilizing these systems to be able to drive consumer perspectives and then contract with the correct tech-enabled solutions in order to implement and meet these goals and objectives. So that's kind of where we've come from and where we've gone and how it's been so important for us to participate in the innovation and the collaborative. So thanks, Twin.
Thank you, Rebecca. And absolutely, that was very articulate and really, again, a highlight to the value of centering on member insight and perspectives to inform your thinking and design for solutions. Okay. So now I'll turn it over to our plan partners. Building off these insights, Kristen, I'll start with you. Can you provide an overview of your plan's efforts and priorities around addressing health-related social needs? And what role can tech-enabled solutions play in helping you meet those priorities?
Definitely. Thank you. Hi, everybody. ITC Iowa Total Care from Iowa recognize the critical importance of addressing health-related social needs as integral components of the overall health and well-being of Iowans. We have prioritized efforts to identify, to assess, and respond to these needs to support improved health outcomes and reduce disparities within our community. We support this work through multiple channels, which include enhancing our assessments to capture our members' immediate SDOH needs, as well as allowing them to voluntarily self-identify their race, their ethnicity, their gender identity, and their sexual orientation. We've expanded our remote monitoring and support for our members who experience chronic conditions, high utilization, and our members on waivers to provide education and resources for those who prefer the non-traditional care management support. In addition, we have online connections, which provide members access to available resources within their communities, as well as we are in the communities assisting and connecting our members. We've collaborated with local community colleges to create and support online certification programs to allow individuals the flexibility to improve their education. And we've leveraged technology. We aim to improve access, efficiency, and outcomes, and ultimately advancing health equity and improve the well-being of our overall community.
Thank you so much for that response, Kristen. Stephanie, I'll ask you the same question. An overview of your plans, efforts, and priorities, and the role you see for tech-enabled solutions.
Sure, thanks, Twin. We very much like what Kristen was talking about at Passport by Molina Healthcare here in Kentucky. We take a whole person approach to how we view our members and their needs and how we tackle solving the problems that we're all trying to work together to solve for our member populations. When it comes specifically to social needs, we have a standard health risk assessment in Kentucky that was actually developed by the Department of Medicaid that we deployed last month. It's a new assessment that came out. But even before that, our health risk assessment was asking some of those questions like Kristen's referring to for members to be able to self-identify race, ethnicity, gender, separate from gender assigned at birth, pronouns, all of those really important pieces of information so that we truly understand who our members are and can truly meet them where they are. And we know from those health risk assessments and the data that we've been collecting in the last year alone, not even going back farther than a year, the three kind of hottest topics that our members have identified as needs for them in their social needs perspective are transportation, housing, and food insecurity. They are the three that bubble to the top all of the time. So we as a health plan know, of course, that we have to prioritize efforts to intervene in those aspects of our members' lives and in our state. And so we have a lot of initiatives underway, like Kristen was describing. There's a lot that we do in the space where, just to name a few of them, beyond this project that we're involved in with the MIC is, we have numerous projects around housing and rental assistance that we're working with local organizations on. We've done some work very recently on extending hours for childhood vaccinations to make it easier for our working families to get their kids in to those appointments. We're doing work around transportation in some of those spaces. All of these really small pilots to see what works, intervening with a particular problem, and then learn from that and expand upon it, of course, would be the ultimate goal. We have a quality department here, kind of to hone in on what we're doing here with this project with Farmbox RX. We have a quality department that's developed a dashboard that's really specific to HEDIS measures. But what this dashboard does is it allows us to drill down and filter by race, by gender, by age, by region of the state, and even down to zip codes. And so we're looking at this from a HEDIS perspective, but it tells us so much about the populations in various parts of our state, about our male Medicaid population versus our female Medicaid population, what the differences are across ages. And so we really try to use data to inform our decision making. And with this particular project, what that data told us, we knew we wanted to work with members with diabetes. And the data showed us that there are zip codes in Louisville, Kentucky, where individuals with diabetes are not getting their A1C checked at the same rate as other individuals in the state. And they have poor A1C control compared to other individuals in the state. So we identified this disparity that helped us to target where are we going to intervene with this project. And then our tech-enabled solution, Farmbox RX, is there to actually intervene. They are sending food boxes to our members. They are calling our members with calls to action about their health specific to diabetes. And I think that's how we can really use these solutions, is when we have a really targeted problem and a really targeted population to hone in on that together and try to make a difference with them.
Thank you so much for really describing how you're intervening based on data that you're getting from members and additional data that's available to you to give you this full picture of needs and assets of your members. So while I have you, Stephanie, I want to ask you a little bit about you and Kristen too, also participated in reviewing the selections, the innovations that came through what we call the showcase through the project. Can you talk about what are some important criteria that you used as you consider the different solutions to partner with? And Stephanie, go ahead, and Kristen, I'll turn it over to you after Stephanie.
Yeah, so this is an easy one for us. I already let you guys know that we knew we wanted to work with members with diabetes. The other thing that we knew from our local data was the zip codes that we identified where there were disparities with those health outcomes. There's also a food desert there. So we know that food insecurity is a factor with individuals living in that part of the city. We knew that we had these health disparities. And so we knew that we wanted with this project to target both addressing that health disparity and the food insecurity piece at the same time, which really helped us to narrow who we were looking at when considering a tech-enabled solution. And we ultimately settled on Farmbox for specific reasons. One, they have experience working with individuals with diabetes in this specific type of program. You know, they already had member materials created, they had programming created. We knew this was going to be more of a let's work together and tweak this together and not a start from scratch situation. We weren't going to have to completely build something new, which is that experience is incredibly valuable that they bring to the table. They also have experience working with managed care organizations and with Medicaid members. So again, not something we have to teach and bring along. Our partner in this project was already really well versed in the membership that we are trying to serve, and they are accustomed to working with the clunkiness that can be managed care and Medicaid when we're honest with ourselves. So and then, you know, complete honesty, Farmbox was already working with our sister health plans in other parts of Molina. And we got good reviews from when we called and reached out and said, what's your experience been like working with Ashley and her team? They had really great things to say about how that partnership went. So it made just perfect sense for us to go in this direction for this particular project, because we were looking for the experience, and then we were able to kind of get that nod from our colleagues to say, yeah, you're going to have a good experience with this relationship.
Kristen, go ahead.
All right. So I think we heard Rebecca say earlier that, you know, we have member meetings. We hear a lot from our members that transportation is an issue. So we knew we were kind of focusing on, you know, the transportation from that perspective, but I think it goes bigger than that. We also looked at, do any of these tech-enabled solutions have knowledge of our state? Do they have any familiarity of what our state looks like? We have very rural pocketed areas within the state that have some issues with being able to connect with transportation. We wanted somebody or a solution that had that knowledge and experience and kind of knew what that was about. We wanted to make sure that they could be able to provide impact on our members, our providers, had community involvement in some degree, was familiar with that. In addition, we wanted alignment with priorities and goals of Iowa Total Care. And transportation is definitely one of those based on what our data was telling us as well. We have the same type of data as Stephanie was saying, telling us where we have transportation issues, where we have members with issues, concerns that they're not receiving that transportation, and huge areas of SDOH barriers or concerns that we're needing to eliminate. And we wanted the ability to be able to scale it. And so those were some of the big factors that we looked at as well.
All right, thank you both for sharing your priorities and also how the things that are important to you in considering tech-enabled innovation partners. I'm going to shift our conversation a bit to the more implementation side of things. As Vinu noted in her presentation, there are a few pilot efforts underway in the Medicaid Innovation Collaborative State cohort. So Ashley and Mindy, I'd like to bring you into the fold for this part of the discussion. Can you give us a brief overview of your company and tell us more about the specific pilot projects within the state? Mindy, I will go ahead and start with you.
Thanks, Twin. My name is Mindy Knievel, and I'm the founder and CEO of Kaizen Health. And this Medicaid Innovation Collaborative has been a really great learning experience. I mean, it's quite an honor for two reasons. One, we're working with all three MCOs that cover the entire state of Iowa. That is, I don't know when that's ever been done. Like, I mean, that just doesn't happen. And it's so cool to see these organizations like work together and to have like the same goals and to, put in their own perspectives. And also I happen to grow up in Iowa. And I'm a Hawkeye through and through. I grew up in Northwest Iowa, and I started my company because my family struggled with transportation. My family struggled to get access to care, both in Northwest Iowa, in Fort Dodge, Iowa, where I grew up, and also in the northern suburbs of Chicago with my mother-in-law. And sort of the impetus for starting the company were all of these situations that kind of happened over a year's time. And I was like, I did not set out to start a company. In fact, I'm not sure I even ever agreed to do it, but I couldn't stop paying attention to all these things that were getting like shoved in my face to like say, hey, like there's a problem here. Like, and so I see somebody's laughing at me. It's an honor to do the work that we do. We really started our journey in the health system and clinic space, like working to, reduce missed appointments, reduce time to discharge, reduce over usage of the ED for COPD patients. And those pilots went well, and we're like, okay, let's do this. And so now we work in 44 states across the country. We work with every flavor of health plan. We work with K-12 schools, getting diverse learners to school every day. We work with municipalities doing some migrant and asylum seeker work in Chicago, arrestee work. We work with pharma and clinical trials, senior centers, home health, you name it. We do it. We move folks from A to B for any reason across the social determinants. So that could be a jobs program that we're doing up in Detroit with the United Way. It could be, just simply clinical care. It could be getting access to food, the justice system. So it's a lot of fun to be able to truly help a person be able to live their healthiest and happiest life, and to make that impact each day. We have 36 levels of transportation we can offer. Guys, I didn't know that there were that many out there before I got into this world. And we build our platform to really power that, right? Because we're taking in requests from all across the country for all sorts of different needs and matching them with our transportation partners. It's a lot more complex than I ever imagined, with needing to do eligibility and process and adjudicate claims. And there's so many pieces to what we do, but it's such a critical piece. Everyone, like classifies transportation as a social determinant, but it's also a thread throughout the rest of the social determinants as well, right? So without logistics, farm box wouldn't be able to move their food from A to B, right? We wouldn't be able to get it to a jobs program, to housing, to whatever it is. So I just really appreciate you allowing me to share a few things. And I'm going to add one last thing, because Stephanie was touching on it, and we're always looking to innovate and do things a little differently. So one of the pilots that we're doing, we're going to actually start doing health risk assessments in the vehicle. So using some of that captive time in the vehicle to help members get those health risk assessments filled out, right? So you gotta think outside the box, right? And whether that's in urban, suburban, or rural America, it all looks a little different, but definitely thinking outside the box and doing things differently than they've always been done is kind of my jam. Thank you.
Thank you, Mindy, for that very comprehensive overview. Ashley, same question to you.
Great. Thanks so much for having me today. I feel like I'm not sure if I'm gonna be able to top Stephanie, who gave a glowing review on the company that I founded of our program. So thank you, Stephanie. Very much like Mindy, FarmBox RX was founded because of my backstory. 14 years ago, I was on food stamps, pregnant, on Medicaid, living in a rural food desert. And this was before the SNAP and EBT card was able to be accepted online as a form of payment. So I like to say sometimes you need to walk a mile in the member's shoes that you have the privilege of serving in order to know what change needs to happen within our healthcare system. So FarmBox RX is a member engagement company at our core. We use food as medicine to engage the member in in the self-efficacy journey for quality measures where the health plan needs to move the needle. Things like getting a member to go get their diabetic eye exam, to get their mammogram, complete their HRA. And in this program with Molina, as Stephanie said, we run lots of different programs with different Molina plans all across the country. This one was really special to us because of the involvement with Mick and the grant. And this one, as she went into, Molina selected adults that have diabetes that are living within zip codes that they identified that have seen disparities in A1C testing and control. And Molina also prioritized members who require insulin in this pilot. Really, the objective of the program is to provide members with diabetic-friendly fruits and vegetables delivered directly to their home, along with educational resources on managing their diabetes. The initiative aims to empower members adopt a healthier lifestyle and choices that have a positive impact on their diabetes management, including improving members' eating habits, knowledge of their chronic condition, and management of their chronic condition, attending important, important appointments and screenings, and regularly doing blood glucose testing. How do we do that? We do that by engaging the member inside of each delivery we like to call the delightful referable moment, by meeting members where they are at, literally in the home. And inside of each shipment, there's customized health literacy that takes the member on a journey of understanding their chronic condition while fostering a journey of self-efficacy in their overall health by teaching members about benefits they have available to them, like transportation, utility benefits, housing benefits, mail order pharmacy for medication adherence, or what we like to call strategic utilization of benefits. I like to always remind people that, individuals don't know what they don't know. Some people may not realize that they need to go get a diabetic eye exam. And so when you give someone the tools to take that self-efficacy journey, they are going to go take that journey. Things like having food delivered. People don't want to not be healthy. They want to be healthy. They don't have accessibility, and they don't have the ability to afford fresh food, and they don't know what to do with it. We solve that problem for the plans we have the privilege of working with.
Thank you so much for that, Ashley. And I love that delightful referral moment. So on this particular sort of pilot project then, Stephanie, I'll ask you to speak to sort of what is success from the health plan perspective? What does success look like for you at the end of the pilot and perhaps after the pilot too?
So obviously what we want is for all of the members that are participating in this program to have improved outcomes themselves, right? That's our ultimate goal, because that's what we hope is going to happen. We think we're going to improve A1C testing, A1C control, use of the emergency room versus use of PCP, all of those health outcomes that we all want any individual that we know to improve upon if they're living with diabetes. So obviously that would be the biggest win. And that's what we're hoping, because then if we get those successes, we expand this to more membership in that same population. We look at where can we replicate this with other conditions, other needs. How do we do something really similar and move that needle for a small group and then expand again? But if we don't see the fabulous outcomes that we're hoping for, we hope that our evaluation and the data that we gather as a part of this process will give us insights into, okay, what did we miss? What did we not include in this program that we should have, that would have been the missing link? Or, what did we get wrong? What piece did we just implement incorrectly? And then if we can fix those pieces, then we try again. And we look to see how can we do it differently and get better outcomes. So basically, either way, we're looking to learn, and we'll be successful if we learn. We'll have that really great win if we get the outcomes that we're hoping for our membership.
Thank you, and just a really fantastic opportunity to engage directly and hear directly from your members. So, Kristen, I will ask you that same question. What does success look like for you in Iowa?
Yeah, so I think at the end of the day, our primary metric for success is going to lie in the satisfaction and the support of our members, right? We're really looking at this from just because it's such a small window of opportunity to impact our members. Ultimately, we're wanting to connect our members to overcoming their social determinants of health barriers. So we're looking to facilitate connections with employment opportunities. We're ensuring they have access to food, diminishing that social isolation. We know there's a lot of that going on right now, and they aren't aware of it, right? So we're enhancing access to community events and organizations, getting them into SNAP or WIC, right? So that they can, make those connections, getting them to their job or, filling out applications. So that's what we're looking at initially for a short term, is to be able to identify the success of getting them to overcome some of those SDOH needs. We're going to learn from it. We're going to identify what are the rides for? What would they have not been able to get to? What would they have not been able to accomplish if they were not able to have these rides? And hopefully what we're going to learn is we need to fix some things. And then we get to work with Rebecca and the state and figure out how do we overcome some of these barriers for our members, because they are truly barriers to their health. Overall, SDOH impacts a member's health, and we've got to figure out how we work that.
Alrighty, thank you so much, Kristen. And mentioning of the states, I'm going to bring Danita and Rebecca back in for this question. So, how will you partner to amplify the lessons and or help sustain interventions that are found to be successful? And how will this inform your efforts for future partnering with tech-enabled innovations? And Rebecca, you can go first for this one.
Okay. Well, as Kristen said, we're going to collect as much data as we possibly can. We have well, and Mindy's helped us too. I don't want to leave her out of this as well. We've put together a pretty significant and developed this evaluation model to try and capture what the transportation barriers are specifically that we're addressing and how we can start to overcome those on the short term, midterm, and long term. And then Kaizen, helping those members. I love the idea, by the way, of doing the health risk assessments during the transport. We need to put that in our model. Thank you. It's awesome. That will help us a lot, I think, as well. And then working closely with Total Care, with WellPoint and Molina, to make sure that we're really looking closely at the zip codes and the data from the folks that we're providing these services to, and make sure that we truly understand the barriers, particularly from the rural populations throughout our state, and how difficult it really is to access care. We want to be able to demonstrate that there's a reduction in no-show appointments, and that there is an increase in wellness checks and reduction in emergency department visits. And not only is that best for the member, but it's also best for our budgets and what we can do to then justify what we need to do moving forward, and working with our legislative partners for appropriations if needed, once we've finalized what the barriers have looked like, what the potential cost savings are. And then considering, ongoing MCO contractual updates and language that includes the use of these tech-enabled solutions, and making sure that we're providing ongoing support for the member to be able to access these types of transportation flexibilities. And that's kind of how we're going to look at that continued exploration and making sure that we are providing all of the systems of support to increase access for our members in the most cost efficient mechanisms possible. Thanks, Twin.
Thanks, Rebecca. And I love that, getting work done in the context of a panel discussion too. Very effective and efficient. Danita, same question for you.
Yeah, I think Rebecca hit on many of the same points that approaches that Kentucky will take. But I think some of the things that I would like to highlight for Kentucky, of course, our NCOs have, worked closely, with our partners to create that evaluation plan. And so we'll look for the results and the outcomes from that evaluation plan. But I think important for Kentucky is our relationship with our MCOs, and that we really concentrate on closing those measurable gaps through meeting those complex care needs of these specific populations. We do that. We recently had a restructuring here in Kentucky that created our division, which is Quality and Population Health. So we're comprised of 4 branches. And so we have Quality, Population Health, Research and Analytics, and Equity and Determinants of Health. We all work closely together to look at those outcomes from things such as these pilots and any other initiatives that our NCOs are working on. So what I think that I want to focus on is that looking at the outcomes from these pilots, we would align this strategy with similar initiatives that the NCOs are working on to help elevate any successes that we might see. And again, I think that this has also been mentioned, that we would look to mitigate any risk that we have noticed where there's been any gaps, identify those and try to address those barriers. Through our population health, we have a very robust reporting structure. So our NCOs have quarterly reports that they're able to provide this information to us, along with the reporting that's going to come from these pilot programs. So we would quickly be able to see and discuss any information that we might need to address throughout the pilot programs, and again, with those similar initiatives. We have transparent relationships with our stakeholders. We have 17 technical advisory committees that, we have providers, we have people that have lived experiences. So we have lots of input from informed stakeholders that we would be able to share this information with as we're going throughout this pilot program. And again, with similar programs that would be able to provide us with that real-time feedback with these specific populations, with these specific pilot programs that will help, guide us as we go through reporting our outcomes and helping us align strategies. The most important thing that I would like to uplift for us is that through our quality and population health branch, that we would like to focus on policy and system improvement. So that would be our overarching goal.
All right. Well, thank you so much, our panel, for giving us insight into your priorities, the programming and member needs. I'm going to transition us over to the audience Q&A portion of our webinar, given the timing. So thank you to everyone who has submitted questions. We've received just a wonderful number of questions throughout our registration process and questions coming in during our panel so far. We will try to answer as many questions as we can during the allotted time, and apologize in advance if we don't get to your question. So the first question, I think, Finu, for you, is what has been MIC's role in the pilot efforts And you spoke a little bit about how MIC removed some risks for the contracting process. So if you could speak a little bit more to that, please.
Sure. So I think there's been a couple roles. One was helping facilitate some of those partnerships to get started and leveraging the funding that we were able to partner with the Helmsley Charitable Trust to be able to offer some incentives. Once we got the grant agreements off the place, we've been meeting with the teams regularly, so monthly with everyone on the team, including Rebecca, Danita, our state colleagues, to help uncover when there may be challenges, where there may be places where by pushing on one lever or another, we can kind of get unstuck. The other thing we did was we contracted with an evaluation lead who's been helping us guide and facilitate the metrics and making sure we have clear logic models in place. I think a little bit of the nudging and pushing has helped get some of the contracts moving more quickly than they may have otherwise. So our hope is now as we continue is we help try and capture some of those lessons from the pilots and write those up and share those more broadly.
So stay tuned and more to come on that. Okay, so I'm picking a question from the Q&A, a question that came in. And Ashley and Mindy, this question is more directed for you. How do you ensure that the implementation is culturally competent and sensitive? And then specifically, Ashley, is culture taken into consideration when you're creating food boxes for members?
Yeah, I'm happy to answer that and kick it off first. Great question. Super important to us. We rely on our plan partner to let us know the language of which the health literacy that goes out in the box needs to be in for the member that we're going to send a shipment to. And as well as, you know, our member contact center has different agents that speak different languages. To us, health equity is not a multi-language insert that goes into a box. The content needs to come in the member's language, their chosen language. Another aspect of the question around culturally relevant foods, super important. I mean, we've engaged even an Ethiopian population for a plan partner, Asian, Hispanic inspired shipments, because you want to inspire the member that's receiving the food in the box around what their culture's cooking is.
And yeah, I mean, culture and language and engagement is really, really important at Kaizen as well. From simple things like, you know, our all of our communication with the member is available in 57 languages via text, about half of those via voice. That's what like your Verizons and AT&Ts can handle. We have, you know, our team can speak a variety of different languages, and we can keep adding on to that, you know, as that is required. It's also a part of Kaizen and sort of how we have hired internally as well. So we have made it a point to sort of remove barriers. We work in downtown Chicago, right? And there are many folks who live in the south and west sides of Chicago that didn't think that that was for them, or maybe they've, you know, had a past that would have prohibited them from working with other companies. And we've really made it part of our culture internally to make sure that we have that same engagement. And then sort of the last piece of this is our transportation partners are like simply amazing. They're such like good humans. And, you know, at first I thought, you know, I'm a big Apple fan. I like everything being tied together. And there was something to be said about owning the hardware and the software and sort of owning that whole experience. But we realized investing in small businesses all around the country, helping them grow, you know, they're started out of all the neighborhoods that we're serving. They know the culture, they know the language, and they teach us so much. And we're taking that one step further, and I'm going to let out another little secret that we're piloting. We're actually getting some of our transportation partners certified as community health workers so that they can even take that one next step further. They're already there. They're already at the home. They already do so much of this work. And so we are, engagement is really important. Culture is really important. Like being there for the member and not just giving them a ride from A to B or bringing a prescription from the pharmacy to them. It's so much more. And, at the end of the day, the most important thing that we do is engagement. And so culture has to be at the forefront of all of that.
Thank you so much for that. And Mindy, since you touched on sort of working with small businesses that are in the state that you are partnering or working in, perhaps Stephanie and Kristen too, this question is for you. Can you talk more about how CBOs, like on the ground CBOs, are being incorporated into the pilot efforts? And Stephanie, I'll start with you.
Yeah, so we wanted, in our collaboration on this project to have some hands-on in-person opportunities for our participating members if they want to be a part of that. So last month we started offering monthly live sessions where we're doing in-person diabetes education for our membership. They will also include a healthy cooking demonstration, healthy exercise at all levels of ability, those sorts of things. And so one of our primary community-based organization partners is Dare to Care Food Bank. They do a lot in the food space in the state of Kentucky, but they also have a community kitchen that is a demonstration and teaching kitchen. And they are allowing us to use that space for our live sessions for our members. So we're really grateful for that partnership with Dare to Care. And then Play Cousins Collective is a local organization that's African-American owned, and they have agreed to provide childcare for these events. So if a member has kids and could not attend if we did not provide childcare, we are going to provide childcare in the same building. So they just walk down a hall and collect their children afterwards via that partnership with Play Cousins Collective. And we're also providing bus passes to members if they tell us that transportation is a barrier to them getting to the live sessions. So that's specifically how we've been partnering with CBOs in this particular pilot project.
So from Iowa Total Care's perspective, some of the things that we've been working on, we have green to go events where we are doing wraparound services, such as we're including our dental MCOs. We're also including, and I apologize, I have a dog in the background, so if you hear him whining, he has decided it's time to go outside all of a sudden. It is really sponsored by one of our big grocers that is throughout the state, where we provide where they help us and provide produce and vegetables. But we're doing wraparound services this year, which will include community colleges that are within that location. And we do them throughout the state. We'll have 12 of them this year. We're including our DMAC, or our dental MCOs, excuse me. We're also working with primary care physicians and FQHCs within the area to help with members to be able to assist them with closing, PCP visits and closing any additional care gaps that are needed. Transportation will be provided if necessary. And in addition, we also have our Find Help link where we're able to utilize Find Help to assist members with getting resources as well. And so we're utilizing different methodologies that make sense for our members to connect with certain resources based on their need. We also have a resource team. So when we identify based on our health risk assessments, the immediate need from our members, our resource team is making those outreach calls to those individual members to be able to connect them directly with any community-based organizations that are required based on their need. So we're just working multiple avenues that are based on that whole person health versus one off here, one off there.
Thank you. And that's absolutely essential, is providing opportunities for members to engage in the way that they would prefer. Okay, so this next question I'm seeing is what, and perhaps for Rebecca, this question could be for you, and Danita, if you'd like to answer that too. What would you say are the top 3 things to consider if a state wants to pilot this work?
You's probably cringing that you asked me this question. Gosh, let's see. From the very beginning, so the collaboration with the MCOs is incredibly important so that we were able to communicate. And so I mean, I told them right up front, I want to look at transportation. So that's where I want to go with this. We're going to see if the research plays it out, and then being able to communicate and collaborate with the MCOs to be able to accomplish that. And then, you know, that's kind of where we took it from right from the very beginning, was that collaboration piece, being able to pull them back in. Being you helped a couple of times, we made it happen. And then paying attention to the research is the second part, because the research is where you're going to get sustainability. So once you've developed the data, you can submit the data, you can work with your MCOs, then you're going to find sustainability there if you've really etched out a place that has demonstrated that you're filling gaps, you're knocking down barriers, and folks are getting access to the services that they need. And then probably the third one would be right from the very beginning, when you figure out where you want to go with one of these solutions, start planning for evaluation. Because evaluation on these types of services is hard. It's difficult. And I don't want to sound ungrateful, because we are 100% blessed to be able to have gotten some of the funding from the Helmsley folks. But that did take us in a little bit of a different direction. So initially we were talking about transportation. Let's get people that does services. Let's bring down that ED number. And then we kind of threw in but let's talk about diabetes. So let's maybe put a focus there. So being able to be flexible, being able to understand why you need to be flexible, communicating that with the MCOs, and getting that evaluation plan right up front, because they're hard. And it's hard sometimes. These are very soft numbers, and it's not really quantifiable. And so much of it is anecdotal. And so those are my 3 things to consider if you want to start working on a pilot.
Yeah,
Thank
I
you
think
for
very similar to Rebecca, but I think, you know, for me in Kentucky, I think that when we approach things like this, we really want to focus on what our outcomes will be, and if we can impact policy improvement, that is our overall goal. We want to look at that specific population and what are the most critical health outcome needs for Kentucky. But as we look and identify those specific populations, are there any barriers as far as the impacts that we might have on policy improvement? So we want to think about innovatively, where can we make the most impact for those specific populations that we want to address, and make those decisions there. Definitely, as Rebecca said, you know, once we get into this, let's look at the evaluation and how we can sustain this. What is the most realistic way that we can sustain this? Are there other programs that are currently in place that we can align these pilot programs with? The greatest way that we can measure what we're doing is that for Kentucky, we like to look at similar states. Are there other successes for states that look like Kentucky? Can we communicate with those states and find out how did you do this? What were your most successful methods? And also, did you run into any barriers? We'd like to know what those barriers were before we step into this. And, we can work from those lessons that they learned since they're most similar to Kentucky. Most importantly, I think as we go into these things, we want to find out from those that are going to be impacted by the work that we're doing. What is your feedback? What can we hear from you about what do you need from Kentucky DMS? And how do you want to be involved in this process? So I think those would be the three priorities for Kentucky.
Benita and Rebecca, thank you so much for that. And just really about highlighting the importance of connecting with other peer states. So with that, looking at the time, I unfortunately have to wrap up our Q&A portion. Thank you so much for all your thoughtful questions. We're just really excited about the different opportunities to really pilot and learn. And with that, Vinu, I will hand it over to you to share details on how interested states can get involved.
Yeah, so thank you to Twen and all of our panelists for sharing your experiences with the Medicaid Innovation Collaborative. And if you could go to the next slide, we're also really excited to start a new cohort working with new states. So I know there was a question in there about, has Ohio done this? Well, Ohio has not, and we would love to be able to partner in new states. We are going to be focusing again on health-related social needs. We feel like we barely scratched the surface, and there's so much opportunity to bring some of these solutions for Medicaid members. So if you are from a state Medicaid agency or a plan and can work with your state Medicaid agency to get excitement as this as a priority, we really encourage you to participate in this program and email me personally. My email address is there. We also have shared some of our findings through some blog posts that we completed in partnership with CHCS that when we send around the slides, we'll link you to. And you can always learn more at the Medicaid Innovation Collaborative website, where you can see a little bit about the research and what we've done in the past. So really excited. We're kicking off this next cohort and hoping that from what you saw today, there'll be some interest in bringing this program to your state. So with that, I'll pass it back over to you, Twin.
Okay, wonderful. Well, do get in touch with Vinu if you're interested. And a big thank you again to our wonderful panelists for your time and all that you do in Medicaid. Thank you to our audience for spending a part of your workday with us. We look forward to sharing results of the pilot efforts with you at a future webinar, so stay tuned. Be sure to visit our website for resources as well as MIC's website, and subscribe for email updates for that future webinar. And finally, please complete our survey. We love hearing from you, and have a wonderful rest of your workday. Bye-bye.